I think Marcella.
Yeah, Marcella. You ready to steer the ship today, Marcella, then?
Yes, if I can quit coughing.
Yeah, and I'll try to support as best I can with the blessing of BPAC as a whole. I see Laureen with the thumbs up, so thank you. Yeah, so today, yeah, I was informed that today's a Star Wars Day, May 4th. I'm not big into movies, but right, May the 4th has something to do with that. So, yeah, so happy Star Wars Day. But with Marcel, if she's ready, we can kind of run through the slides here. If I remember right, we usually kick it to Donda to go through roll call.
Sure, I can do that. Let's go ahead
and start until just a couple of minutes ago. I'm so sorry.
No problem, Marcella. Let's go ahead and start with Travis Ayers.
Good morning, everybody. My name is Travis Ayers, and most importantly, I'm a man in active and sustained recovery. And because of my recovery, I get the ability to be with the 51% and on the recovery committee. So thank you guys, and I look forward to this amazing day.
Thank you, Travis. Lori Banks.
Good morning, Lori Banks with Aurora Mental Health and Recovery. I will be on camera in just a few minutes, but good morning to all.
Good morning, Lori. And let's go ahead with Natalie Brown.
Good morning, everyone. Natalie Brown with Summit Stone Health Partners and Spirit Crossing Clubhouse. I use she, her pronouns, and I'm happy to be here. Member of the membership subcommittee and the recovery committee.
Thanks, Natalie. Charles Davis.
Charles Davis, CEO at Crossroads Turning Points. We serve Southern Colorado. Happy to be here.
Thanks, Charles. Let's go with Jacob Fry.
Good morning, everybody. Jacob Fry, Director of Operations with Sobriety House. Good to see everybody.
Good to see you, Jacob. James Gannon.
Morning, everybody. James Gannon, the person in active and sustained recovery. I'm on the BPAC committee as the Director of Programs with Advocates for Recovery Colorado, and I am on the recovery committee, and it's he and him.
Thank you, James. Lorraine Gilroy.
Good morning, everybody. I'm Lorraine Gilroy. I'm a member at Frontier House Clubhouse in Greeley, and I'm a part of the Clubhouse Coalition. We have programs for adults with mental illness.
Thank you, Lorraine. Margie Grimsley.
Hi, everyone. It's Margie Grimsley with the Colorado Federation of Families for Children's Mental Health, she, hers, and Membership and Prevention Committee.
Thanks, Margie. Lorraine Hall.
Hi, I'm Lorraine Hall, person in long-term active recovery and also board member with Life Ring Secular Recovery for people of all faiths and none. Glad to be here today.
Thank you, Lorraine. Candace.
Hello, my name is Candace C., woman living in active and sustained recovery. Happy to be part of the 51% in this group and serving on the recovery committee.
Thanks, Candace. Megan Shelton.
Good morning, everyone. It's good to be here with you all. Megan Shelton. I go by she, her pronouns, and I am currently serving as the interim division director for strategy, planning, and engagement at the BHA.
Thank you. Dennis Streeter.
Dennis Streeter, creator and producer of our community broadcasting network and the primary caregiver for my wife Sue with dementia. and I'm on the prevention and membership committees.
Thank you, Dennis. Laura Dykes.
Hi, everybody. Sorry for being late. I'm in California and the time change threw me for a loop for a second. I'm on the treatment committee. Thank you.
Thank you, Laura. Let's go ahead and Bonnie Holiday.
Good morning, everyone. My name is Bonnie Holiday. I'm your prevention TA. I'm an employee of the Colorado Department of Public Health and Environment, and I'm here to provide you with any resources or information related to prevention in Colorado. And I use pronouns she, her, hers. And I'm having a problem with Zoom, so I'm going to sign off, but I'll be back.
Thanks, Bonnie. And let's go ahead and go with Victoria Lasky.
Hello, everyone. My name is Victoria Lasky. I use she, her pronouns. I am the Associate Director of Safety Net Licensing at the BHA.
Thanks, Victoria. Ron, I know you were on mute, but are you able to introduce yourself to everybody?
Yeah, can you hear me okay?
You sound great.
Okay. My name is Ron Lobato. I'm the CEO of Alliance Mental Health. We're an outpatient mental health agency. We just moved into Colorado some months ago, so I'm a first-time caller, and I'm here to learn. Thank you.
Thanks, Ron. Tanya Wheeler.
Good morning, everybody. Tanya Wheeler. I use the pronoun she, her. I'm the Executive Director at Advocates for Recovery Colorado, and I'm a guest.
Thank you, Tanya. And Knudsen?
Yeah, Ann Knudsen. I use she, her pronouns. I work at Denver Health in the compliance department, and I'm here to learn as well.
Thank you. Stephen Hedgepeth. Hedgepeth.
Good morning, Stephen Hedgepeth with Healthcare Perspectives. I'm a guest just here to learn and understand more.
Great, thank you. Kelly Gill. Kelly, are you able to unmute?
Can y'all hear me?
Can hear you now, thank you.
Oh, yay, good, okay. My speakers have not been working earlier today. But anyways, hi, sorry. I'm Kelly Gill, and I am with the Colorado Community Health Alliance, which is race 6 and 7, and I am just here to as an observer and learning. Thank you.
Thank you, Kelly. Andrea Jones.
Good morning, Andrea Jones, she, her, hers pronouns. I am the Deputy Policy Director over at the Behavioral Health Administration. Good morning.
Good morning, Andrea. Frank Cornelius.
Hi there, Frank Cornelia, Deputy Director of the Colorado Behavioral Healthcare Council, member of the public.
Thank you, Frank. I had a S. Samaro.
Yes, good morning. I'm Stacy Samaro. I am with Crossroads Turning Points, and I am just here as a guest to learn.
Thank you, Stacy. And let's go to Stephanie Johnson.
Hello. Yeah, Stephanie Johnson with Well Power. I'm the Director of Community Relations and Public Policy there.
Thank you, Stephanie. Annette Zacharias.
I'm Annette Zacharias with Family Housing Network up here in Larimer County.
Thank you. And Marcella, let's go ahead and have you introduce yourself. Marcella, are you there? Oh, I think she stepped away. Ryan, let's have you go.
Good morning, BPAC. Ryan Templeton, he, him pronouns. I'm the Policy and External Affairs Division Director with the Behavioral Health Administration.
Thanks, Ryan. Is there anybody I missed? Nope, then let's go ahead. And Ryan, it's all yours since Marcella has stepped away for a minute.
I think now up next is the minutes approval. I hope folks were sent the minutes from April 6th meeting. And if
I move to approve the minutes.
I'll second that.
Yep, so this is the opportunity for a discussion related to the minutes if there's changes, and then if yeah, we have a a proper first and a second. So if there, we'll kind of work backwards here. If BPAC members that want to abstain, now's your chance. Vote no.
This is Charlie Davis. I have to abstain. I was not at the meeting.
And yeah, thanks, Charlie. And to be clear, if you are a BPAC member, you don't have to have been present in the last meeting to still vote for them. This is a council document that, yeah, it's voted on today. As long as you're comfortable with what the document says, you're still able to vote. But yeah, it's complete control for each of you related to abstaining, voting yes or no. So with that, all in favor, board members, let's kind of raise hands, yeses, thumbs up, and so the minutes are approved. So with that,
Thank you all.
awesome. And then if we go to the next slide, which I saw briefly there, Donda. So there, want to just open this up to acknowledge that there has been some changes within the Behavioral Health Administration. So with that, a few weeks back, there has been a transition with the commissioner of the BHA. Dr. Morgan Medlock is no longer the commissioner of the Behavioral Health Administration, and Michelle Barnes, who, if that name sounds familiar, she had been serving as the executive director of the Department of Human Services. So she's very, very familiar and has been very familiar with the BHA. Prior to the BHA, the Office of Behavioral Health, as being the executive director. Michelle was asked by Governor Polis to serve as the interim commissioner, so step away from her role as the executive director of the Department of Human Services and take on the interim role of the BHA commissioner while the governor's office goes through the national search for a new commissioner. So with that, we don't have really any information related to kind of details of change, but this is the initiatives, the duties, the responsibilities of the Behavioral Health Administration still stays completely the same, really, with that mission of co-creating that people first behavioral health system that meets the needs of all people of Colorado. The mission, vision, the values, the truth, equity, collaboration, community informed practice, and generational impact. All of those things stay the same. All of those initiatives are still happening within the Behavioral Health Administration, and really focusing back in on what does that really co-creation and really mean, and collaborating with partners like BPAC to really inform what does behavioral health in Colorado need to be. How do we support our providers that are working now? How do we expand providers? How do we make sure that there are services for everyone across the state? I think BPAC has been really a leader in what does the system look like? What does the system need? And I think that's the foundational piece, and really I want to lean into groups like this to really help drive home that what does behavioral health in Colorado should be. And I think that's a good segue into the next couple months of BPAC with these recommendations for the block grant is the exact right time for this as well. So I just want to more so open this up for if there are questions, if there are comments, if this is kind of that opportunity to kind of acknowledge where we have came from and where we're going, but just wanted to make sure that we have a space here at BPAC to have that conversation. We will have Interim Commissioner Barnes attend the next meeting if we can. We invited her to this one, but with kind of the transition over to the BHA, it just wasn't able to work out today. But we'll make sure that she gets here and introduces herself as well. So, is there any questions, comments?
Ryan, I have a question. This is Lori. Do you anticipate any slowdown in any particular areas because of this change, knowing that, the concepts stay the same, but any particular area that may be slowed down?
Yes, Lori, fantastic question. So kind of three things are slowing down. So the regulatory the behavioral health entity license. So that license that was created in 2019, or the bill that created a new licensing structure for what was supposed to be all behavioral health facilities or community-based behavioral health facilities. So not talking about hospitals or psych hospitals, but those community-based, that was created as a license at the health department or CDPHE, that was to transition underneath the Behavioral Health Administration starting July 1st of 2023. So a bill this year, House Bill 1236, we extended that time frame for that behavioral health entity license to transfer to the BHA starting January 1st of 2024. So a 6-month delay in that, just to allow some additional stakeholder time. Victoria's here too. Talk about rule timelines shortly. That's one piece. We also got an amendment into House Bill 1236 to extend the behavioral health administrative service organizations for an additional year. So those BOSOs were the intermediaries that were supposed to combine the ASOs, the MSOs, and the direct contracts with community mental health centers into an intermediary structure. That has been delayed by a year, so it was supposed to be fully implemented by the July 1 of 2024. That has been moved back, as long as the bill passes, to July 1st of 2025. And then one other timeline shift that really isn't specific to the BHA, but it's specific to the BHA programs, is that last year there was House Bill 22-1256, which made a bunch of changes to involuntary mental health care, or 2765. So Title 27, Article 65, which is kind of outlines how services are provided to individuals on involuntary mental health status. So like holds and certifications. So within that bill last year, there was a 3-prong or 3-timeline approach to when things go into effect. One of the effective dates was going to be July 1 of 2023, that expanded or changed how involuntary holds, or M1 holds, or 72-hour holds, whatever you want to call them, were to be implemented, allowing for additional back-to-back holds with additional patient rights that come with that. So with that was also extended until January 1st of 2024. Part of that being is that the Behavioral Health Administration has a specific role related to supporting emergency departments when emergency departments have individuals within their EDs, that the BHA would help support finding placement for those folks. We are struggling with hiring staff within those care coordination roles. So it was an agreement between advocates as well as the Colorado Hospital Association to extend that effective date of that new mental health hold section of statute to January 1 of 2024 as well.
Maybe
So those are
Thanks,
a
Ryan.
calendar would help.
It's a lot. Thanks.
Very confusing.
Yeah, thanks, Ryan. I appreciate that. But I feel like some of those changes were already in place or happening before the resignation of Dr. Medlock. So I guess I was asking, do you anticipate anything's being slowed up based on her departure and the move to Michelle Barnes being the whatever the exact title is of her role?
No, I don't necessarily see any specific things delaying outside of those. Ultimately, we have to meet the statutory deadlines is first and foremost, and those were really the 3 timelines that we could see get changed. It's still, all of the other pieces are still in line. What we're working on now is making sure that we're clear on what expectations and a flow of what needs to happen. I think there was just a mad dash of there's all these initiatives happening without a clear plan for related to this has to happen first versus what else is happening and what that flow looks like. And I mean, even next month, I mean, coming back to Bhpac, I think would be a fantastic opportunity for the BHA to provide that, hey, this is what is happening now. I'm sure you have been hearing about the rule promulgation. What does that mean? And what's the difference between the provider rules versus this larger safety net system redesign? And where does care coordination infrastructure fit in? Because there's care coordination with providers, but also this larger, hey, the regional accountable entities through Medicaid also provide care coordination. All those things fit top priorities, but was still fully focused on the statutory deadlines.
Great, thank you.
Ryan, this is Margie Grimsley. I just wondered, does this change have any impact on the work that we do regarding our recommendations, or just to make sure that we're not needing
Nope.
to know anything that we should know?
Nope, this change does not impact the recommendations. It's still the BHA submitting the block grant application to SAMHSA in the fall. So it's making sure that there are the recommendations coming from this group is a part that is federally required for us as a state to submit that application to the feds to pursue that block grant application. So that is fully still there. And I think that's a piece where we want to make sure that we are still hitting those things within BPAC for those recommendations coming to the BHA.
Thanks. I know we have a lot of new people on the call, so just for their clarification, so they really understand the distinction and the unique piece of our work in this council.
Yep. Thank you, Margie. Yeah, so is there any other questions that you may have about kind of the structure where things are going? Yeah,
I guess,
Laura.
yeah, my question is just in general, as much as you can speak to it about, morale and the well-being of staff who are working in the BHA. It's a lot of changes and, pretty quick changes. So how is everybody doing?
Thanks for asking. I mean, it's change is tough, right? I mean, I think there's been this kind of a mad rush since the BHA has been created, and even leading up to the BHA. And I think there is that piece of like coming back together and setting those core expectations of what the BHA has been even a little bit refreshing. I mean, speaking for myself, it's been nice to get back to those core. Why are we here? What are we doing? And what are the top priorities? Which I think I think councils like this kind of keep me personally grounded into hey, we are all here for a reason, and that's creating a system that works for everyone, right? Like, I think that, and getting back to those core things rather than just nose to the grindstone every single day. Maybe a little bit of a relief as well with okay, there is this support from the kind of the larger executive branch of government as well, has been really pretty positive as well, right? I mean, change is hard. I think we all know that, but it has been one of those ones where it feels like there is a little bit of I think change can be very positive as well. So, but I appreciate you asking that as well, Lauren.
I would just echo on that too. I really appreciate that question. And the same, everything that Ryan said. In addition to that, I don't know if y'all saw, I put in the chat that our interim commissioner, Michelle Barnes, actually chaired the governor's behavioral health task force in 2019, which resulted in the creation of the BHA. And so I think it was very strategic having her serve as interim commissioner, as she's been involved since the beginning. She's very passionate about what we are doing. And it has been very helpful to slow down and refocus on our purpose and our priorities. So I just wanted to add that too, that I feel like the BHA is in really good hands while the governor searches for who our next commissioner will be.
I also want to stress or add on that Commissioner Barnes and our leadership team has made it very clear that staff is to start taking care of themselves. And we have had speakers come in on working on transitions and times of change like this. So it has been good that they have focused on their staff as well as what's going on the outside as well. Something none of us ever do.
How timely for Mental Health Month, Mental Health Awareness Month of May. Just saying.
I would just wanted to throw out there, probably for you all and for everyone. I've been in California for the National Behavioral Health Conference, which if you haven't been, it's a pretty good conference. And I learned a new acronym. That's my new favorite acronym. It's GROSS, get rid of stupid stuff. And the person who was doing the presentation on GROSS, get rid of stupid stuff, was talking about being busy, being stressed, and being overwhelmed. And being busy is fine, right? Being stressed means you need help. Being overwhelmed means you need to stop. And you can't do things, you can't function when you're overwhelmed. And then you need to like stop and look around you and figure out what you need to, reset your goals and all that stuff, because you can't really function being overwhelmed. So I hope that whatever's happening, this helps you guys at the BHA to be able to, there's a lot of things to do and you can't do everything at once, which seemed like what was happening. So hopefully figure out just being stressed instead of overwhelmed.
This is Margie. I just want to add also, I'm sure it is stressful in your world, but I think it was stressful in our world of hearing that, and just, as Laura said, things were moving so quickly, and it's really, how do we ensure the population at large that that these changes, how will they affect them, and hopefully we can bridge this period of time where change is happening and make sure that we're taking care of folks in the moment.
I will add that our goals and our objectives are still exactly the same. And Michelle has made that very clear, or Interim Commissioner Barnes has made that very clear, that we are still moving forward with everything that we had. We just may be reprioritizing or readjusting the way we get there. But all of the goals are the same and the treatment is definitely the same.
Yeah, and I'll also offer myself up if you want to talk offline in a more personal setting. I'll offer myself up for that as well, about where things are going, how things are working. I know that large meetings like this aren't always the most conducive to asking questions that you may have. So definitely don't hesitate to reach out to me directly. I want to make sure that y'all, BPAC members as well as guests, have access to folks at the Behavioral Health Administration, because this really is one of those agencies that is about co-creation and a networked approach to government, and making sure that we are utilizing the expertise that the people of Colorado actually have. So yeah, I want to make sure that you know that I'm available for each and every one of you as well. So I'll put my contact information in the chat here, but do not hesitate to feel like, oh, I can't reach out to Ryan here, because I am here for you all as well. Yeah, so as we transition to the next agenda item, the rural stakeholdering updates, Megan and Victoria, we'll kick it to them. You can probably stop listening to me talk. If Marcella's read, or have we got Bob? Over to Megan and Victoria.
Thanks so much, Ryan. And I'm wondering if I just have one little slide that might be helpful to follow through with what I'm saying. If I could steal the screen, I think maybe I can just do that. Or I think I might need to wait until this one's taken down. Thank you, Donda. All right. Oh, I didn't do what I wanted. There we go. All right, so hello everyone, good to see you. As Ryan introduced, we are expecting a delay to the provider rules due to a legislative change. We are expecting that delay to be for an effective date of rules for January 1st, 2024, which is going to give us some additional time to engage with stakeholders, which we're very excited about. And we've got a big stakeholder calendar that we are working on getting out to you all and to all others who are interested very soon. So as Ryan mentioned, we have this pending legislation, House Bill 23-1236, that includes this new timeline for rules. Which gives us, we were previously operating on anticipating an October date. This gives an additional 3 months. So this includes our behavioral health entity license rules per that license that was created in 2019, as Ryan mentioned, our safety net and care management rules, and also the 2765 involuntary designation rules. There are some updates that we need to make to those based on some legislation that passed in 2022 that addressed the rights of people receiving involuntary services. So with that, we are planning to re-engage with stakeholders through June 23rd, 2023. That is because we need to get the rules to our Attorney General's office for legal review starting July 1st. So we are using as much time as possible to talk with stakeholders, get input on these rules. Then we'll take a week to integrate that feedback that we've received as appropriate and get those moving on their way to hopefully being approved by the State Board of Human Services. So what that will look like is we already have updated rule chapters for the BHE license available on our laws and rules webpage, which I will drop in the chat once I'm done presenting. You can review new rule chapters as of mid-April and provide any written comments through our email inbox or our survey link. We will also have a lot of live stakeholder sessions. This will include both virtual and in-person sessions. Some of them are already on our stakeholder calendar for specific rule chapters. If you attended the rules town halls back in December, that was a little in-person engagement throughout the state through May and June. And we have a few additional opportunities for lived experience engagement, including a session conducted in American Sign Language for the deaf community and a session conducted in Spanish for Spanish-speaking communities. So a variety of lived experience sessions as well. In addition to some targeted outreach to different provider groups. So we are planning to get that information out to you all very shortly. We are still working on firming up some details as far as dates, getting Zoom links all together. I wanted to come to talk to you all this morning to just give you a heads up about this, to be on the lookout for it, and say that we're really looking forward to engaging with you all on these rules throughout the month of May and June. We have a stakeholder event almost every day. So just wanted to make that announcement, and I will take any questions you all have and then also drop those links in the chat.
Victoria, I have a question. So yes, you mentioned updates for 2765 involuntary designation rules. Is it just an update or is it a rewrite?
So I want to say almost or both and. So the reason I say that is just we currently have 2765 involuntary designation rules, but it is a pretty substantial rewrite to them based on House Bill 22-1256. So in some ways it's an update in that it's not something new, whereas the behavioral health entity license is new, but we are pretty substantially updating it. It comes to about 90-ish pages with including all of the new information and rights that are included in that designation.
Thank you.
You're welcome.
Hi, this is Angie Wold from ARCS. I apologize if you mentioned this, and if you did, I missed it. Previously, they were going to start enforcing the rules in April, so will that also be pushed out?
Oh, the delayed enforcement piece?
Yes.
Yes, so that's still that's open for stakeholder discussion as well. We had originally anticipated a delayed enforcement. So no rule violations issued unless related to health, safety, and welfare of individuals until April, just if folks hadn't heard about that piece of the discussion. I think that particular part is also open for discussion about what would be a reasonable delayed enforcement, if that would be appropriate. So that is on the table for discussion as well.
Okay, thank you.
Welcome. And I saw Tanya's comment about the in-person stakeholder meetings. Yeah, we're excited to get out in the community, going all throughout the state, trying to hit as many geographical areas as we possibly can in a short period of time.
Here we go.
Yes, I see a hand raised.
Miss Victoria, I am sorry, but I don't know what. What
Health Administration, the BHA, in the Quality and Standards Division. So doing the regulation for different behavioral health providers. Once I'm done chatting with you all live, I will drop that link into the chat where you can find all of our latest information and a link to our stakeholder calendar. So if you just hold tight for 1 minute, I will make sure you have all of that.
does anybody have the time to explain to me how I get it out of the chat into my computer? Because I don't know how to do that, and people refer me to the chat where they and it's not just you, Victoria. I've been dealing with this for a couple of years now, and I've reached my limit, I guess. How do I get it?
Laureen, if I can message you directly through email the link to the laws and rules page on the BHA website, if that, and then you just need to click on that hyperlink and it should open up a new.
Okay, I know how to do that. That would be great, Ryan. And if you have the wherewithal, if you could just explain to me the next time, for the next time I'm on Zoom, when they say we'll put it in the chat room for you, then what do I do?
Okay.
That would be great, because I don't have any kids to tell me what to do with all this stuff.
Sure. Yeah.
Thanks.
So a quick tutorial. There should be like a bar on the bottom of your screen that has like a mute and a stop video, as well as participants in chat. So if you open up that chat like bubble, there should be a bunch of comments that opens up on your screen.
Yes.
And so those where I just put in the BHA laws and rules website link there. So you should just be able to click on that link and it should open up a new screen for you. But it is easier if I just email it to you, which I'll do that as well.
All right. Well, I've made progress, so I appreciate it.
All right, any other questions or discussion from you all? Again, we are working furiously on our end to get all the details firmed up, and then we will be sending out an email blast to our newsletter list, as well as a targeted list of all of our licensed and designated providers and anyone who's attended a stakeholder rules meeting in the past. So we are planning on getting that out as broadly as possible, and you can always find the latest on that laws and rules webpage that Ryan dropped in the chat. Great. I will look forward to seeing you all virtually or in person over the next couple months.
So I think this is the time in the agenda where the subcommittee discussions happen. Correct. Was this where we break off usually into subcommittees?
Yep, we get a breakout into our subcommittees here.
Yes.
Yep. And so guests also fully able to attend subcommittee meetings as well as your choice. Yeah, if we want to go over what subcommittees there are, I'm guessing there's still the prevention, treatment, and recovery, right?
Correct. We have membership, or sorry, membership we're not going to have today, prevention, recovery, and treatment. You should be able to join yourself, and if you can't, just let me know and I can, if you want to message me, I can add you to a room.
Donda, is there a scheduled time when you, the group comes back after subcommittees?
Yep, we will come back at 10:45 and take a break until 11. So if your subcommittee finishes a little early, you get a little bit of an earlier break or a longer break. And if you finish late, just a little bit of a shorter break.
This is Priscilla. Can you get me to the treatment committee?
Oh, I'm sorry. Who was that? If you want to if people want to message me, I can do it that way. Or you should be able to join, but if not, please do message me where you want to go.
Donda, I'm not seeing where the link is to get you to certain committees.
Okay. It may not have come up, and I don't know why it doesn't. It does sometimes and doesn't others. So let me go ahead, and I'm trying to move you all over as quick. Let's go ahead and start. Andrea, where would you like to go?
Hey, I can do either kind of hang out in main room or recovery, please. So
You decide what you like. I can send you to
Okay.
recovery, and if you get bored, we'll bring you back. How's that?
okay, I doubt I'll get bored.
And Bonnie? Oh, I think I lost Bonnie. Goodness.
Marla, to treatment, please.
Was that Marcella?
Yes, to treatment, please.
Okay. Dennis?
Prevention?
Frank?
Treatment, please.
Sorry, guys, I don't know why it's not letting you. Jacob?
Treatment, please.
Lorraine? Lorraine, you're on mute.
Prevention.
Nori?
Treatment, please.
Lorraine?
Recovery. Thank you.
Megan? I think Megan's taking a break real quick.
Yeah, Donda, if you want to just leave me in the main
Okay.
room.
I'm trying to find all you guys. Steven, is there one you want to go to?
Treatment, please.
Okay. Tanya?
Recovery, please.
And Travis?
Recovery, please. Thank you, Donda.
I keep having people coming back to me here. So right now I have Megan and Ryan are the only ones. Travis, did you make it into recovery? Okay.
Donda,
And
I think
Frank?
you sent me to recovery. I was asking for treatment, please.
Oh, sorry. Hit the wrong one.
Thank
Should be
you.
going to the right one now.
Yep, I got it now. Thank you.
All right.
Donda, are you okay if I don't join a subgroup today and then I'll just reconvene at 10:45?
I am fine with that.
And your hair looks amazing.
Okay, back to you, Ryan.
All right, so after the subcommittees, so do we have recommendations to discuss? No? So I guess
We might in a couple minutes. I'm waiting on Margie. We took a late break, but we had a very productive prevention meeting.
Good to hear.
So I don't know if she's planning to talk or not.
Because just to reiterate, the timing of recommendations is that, so previously, or like every 2 years, we go down this path of, hey, this is the recommendation year, right? Where it's usually this month, the May meeting is that BPAC votes on the BPAC as a whole votes on the recommendations of the subcommittees, right? And then that informs the larger what gets submitted to the BHA. And then in the June meeting is that the BHA, previously OBH, would come back and discuss and formally respond in the June meeting related to the recommendations that were submitted from May. Do we feel like we can get there today with those formal votes now about what happened within the committees?
I mean, I can speak for the recovery committee that, I mean, we're ready to present our recommendations.
Perfect. How about the other committees?
I think I might speak for treatment when I say no. We need some time to wordsmith something more specific. What's the hard due date? Can we go over that? Maybe the calendar for the due date for recommendations?
Yeah, so part of this conversation is we usually, or for the last few years, we have recessed for July and August, right? Like we could push all of this back a month, right? So then for June, it would be the internal voting. So the June meeting, it would be committees presenting like finalized recommendations with formal votes. And then we come back in July with the BHA's response, which then gets incorporated. All of the recommendations with the response gets incorporated into the block grant application that essentially has to be submitted back in September. We're going to start running into a little bit of posting and public posting and ensuring or timing with the public posting that has to be available for, I think it's 30 days, with the recommendations from BPAC included in the application that gets posted prior to formal submission. So we're going to be running into end of summer, August, September issues with timing, but I think it's still doable.
Let me see if I understood that correctly, and maybe other people can speak up. So if we come back, groups go off, have formally written recommendations, we send those out somehow previous to the June meeting so that people can look at that, then we vote in the June meeting, correct?
Yeah, that I think would be an offer on the table for BPAC as a whole, and then coming back in July as the response to the recommendations that you all voted on formally in June.
I feel like that's doable for treatment. I'm not sure how the other committees feel.
I agree if we follow through with the plan to get an email going and wordsmith the language we want to use. Yes, I agree. Thank you.
Brian, just to clarify, this is Margie. So we'll vote on what people will say in June, but then in July, we'll make comments about it? Or should it be the flip where it's presented in June and then you vote on it in July? Just a thought.
No, I think June would be the whole process where it would be essentially each committee. I think previously there was like a presentation from each committee saying, these are the recommendations that the committee had put forth. And then BPAC members as a whole vote at that time. And then ultimately those 3 presentations get rolled into a document that gets submitted to the BHA as kind of the final, here's BPAC's formal recommendations submitted to the BHA in beginning of June, and then the BHA comes back in July with here's our the BHA's response to the recommendations and how we're going to work to implement these recommendations.
Okay, thank you. That helped. That makes more sense. I just misheard.
Tanya.
Thanks, Ryan. I know that I'm a guest here, but I just want to, as a person.
You have some history, Tanya, with BPAC.
Lots of history. And I know about the importance of the timelines. And I want to say that the recovery committees worked really hard to get all their stuff ready today. So I would encourage the council to hear those. Secondly, my experience, because I was around before BPAC took that break in July and August, is what happens is a lot of people are on vacation. There's a lot of people missing. I understand the critical, and so maybe next month those prevention and treatment per se might present and vote, just to keep everything on the same timeline, because what happens is you don't have the people in those July and August meetings to make the recommendations, and the BHA needs all of that information early to be able to write a good, solid application for the block grant. So that's my 2 cents.
Yep. So just to reiterate all of that, like June has to be the absolute last meeting for this fiscal year that would have like discussion and voting opportunity for BPAC with the submission of those recommendations. Just like Tanya said, because of the timeline to get the application completed, posted, and then ultimately submitted to the feds. So like the action from BPAC, like June is the absolute deadline. So, I mean, a couple options would be if there are subcommittees that are ready to present those and that we can have the formal vote now, we could do part of it in the next hour or so that we have together today, and then push, say, treatment, and I don't know where prevention is. Could potentially do those ones as more of a beginning of June, making sure that we get those, making sure that we have those conversations, and see where we're at with timing for, I guess, the last 50 minutes today, and then just see where we end up.
I like that idea. Looking ahead, the July meeting is July 6th. I'm sure a ton of people are going to be out.
Yeah, so the July meeting would be more of a response from the BHA back to BPAC, right? There wouldn't be formal voting from BPAC per se. It would be here we receive these. This is our time to have a conversation with BPAC about where things are at. I mean, I think I haven't seen any of the recommendations that y'all have been working on, but I'm guessing there's going to be some, how does this fit into larger initiatives as well? That it doesn't necessarily just have to be BPAC or block grant recommendations as a response as well, but just more so going off of what recommendations from prior years have looked like.
Just from the prevention, we have the larger structure, our recommendations. They need to be wordsmithed, but we've got our overview recommendations.
Candace.
Yeah, I was just gonna ask, like, I know you would like to wordsmith your recommendations for formal submission, but would you be comfortable presenting them to us today, so that we could make a vote and stay with the timeline? If not, I understand, just, I don't know, maybe that would afford, you could present today and then get together as a committee outside of this meeting to kind of formalize the submission verbiage.
Are you talking to prevention?
and treatment. I wasn't sure where prevention was at. I just know.
Yeah, we can do that. Again, we would need to wordsmith the final, but we can give an overview.
Yeah, I think we go down that path is great, and maybe we start with recovery first, since it sounds like recovery is potentially the furthest along with the kind of the wordsmith recommendations. So then we can even, well, I should say, you all can make that determination if you're ready to formally vote as a BPAC as a whole on those recommendations. So then we could potentially even get ahead of the game for June if we have to move this into June.
Yeah, and I'll just throw out there. So we, y'all shouldn't suffer because treatment providers like to talk and can't make decisions and push it back. And we lost our chair of the subcommittee, so we kind of lost some groundwork. But I will start an email group with the people on the treatment committee, and we will wordsmith it out through email over the next like 2 to 3 weeks and get it done ahead of the next meeting. I think send it out so everyone could look at it and we could make like quick work of the treatment recommendation. That sound good to everybody?
I like it. And also, I'm not a BPAC member, so you can also just say, Ryan, zip it. Like, we're going to do our own thing. I'm comfortable with that too, right? So, yep. So that's to you, Marcella. We'll kick it to you about how you want to move forward.
Ryan, I think you're an honorary member, whether you like it or not.
Okay, I appreciate that.
That's right. That's right. He will always remain a member. And I'm the wrong one to be asked to zip it. So I'm glad we can ask somebody else. Don't ask me to zip it.
And you can always tell me to zip it. So. But yeah, so I mean, with that, if the group is comfortable, let's kind of kick off the recommendations from recovery.
Awesome. Thank you, Ryan. So I'll share my screen if I'm allowed to. Can everybody see the screen now?
Yeah, but I'm a little frustrated that you're setting the bar so high for coming up with recommendations.
I don't think it's a bar that we've set because it's literally, they're very basic slides. It's not a whole lot. We also understand everybody on our committee and everybody, is super, super busy. So we just kind of put our recommendations on some quick slides. So no graphics, no emojis, no nothing like that. So I don't think the bar has been set anywhere. So
and the recovery community rocks.
So this is going to be the 2023 Behavioral Health Planning and Advisory Council. This is the Recovery Committee's recommendations. We have 3 total recommendations. Lorraine and I think Nat, we're going to take this first slide if Nat is still with us. If not, I'll help out.
Yeah, Nat, are you there? Or I see your picture, so maybe you're not live. So I'll start, and then if Nat's able to chime in, that's great. And if not, you can as well, James. So basically the main thing is that we want to set aside 20% for recovery support services. That's an increase of 10%. And the reason is to further the growth and development of the recovery community centers and the mental health clubhouses and the recovery support service organizations. All of their services and the workforce development that supports the many pathways to recovery. So this 10% increase will be dedicated to the resources focused on recovery support services, and it aligns with SAMHSA's block grant guidance, which are specifically, we want to focus on development in the rural and frontier counties throughout Colorado because they have a dire need. We'd like to build more family support services throughout the state. And for advocacy and education, we spent a lot of time talking about this, that the system-based and peer-based, it needs to be both of those to reduce all of the stigma that still remains, and also to increase awareness of all of the available pathways and resources to recovery. Those are often left out, and there's still a big reliance on 12-step model, the 12-step model as the only way. And recovery is not a one-size-fits-all prescription. So we want to be sure that it includes all of the options like smart recovery, life ring secular recovery, women for sobriety, Dharma recovery, the Phoenix, whatever fits the person's needs. So that's not stated explicitly there, but that's our intent. And then finally, workforce development and peer-specific training, and making sure that continuing education around the supervision of peers. So I think that's basically what we want to start out with. James, anything else, or shall we move on?
No, I think that's stated very well in everything that we've discussed over the last multiple of months. So thank you, Lorraine.
Mm-hmm.
And now we'll go to the second recommendation, which Candace Ludwig will take.
Yeah, next meeting I'll change my last name to reflect my new married name. But as James mentioned, my name is Candace Ludwig. I am a woman living in active and sustained recovery, and I'm here right now to talk to you all about our recommendation for youth recovery support services. So just a little background nugget. I think in recent years, it's become alarmingly apparent the disparity with our lack of recovery support services for young people, specifically youth and adolescents experiencing substance use disorder. So our recommendation,
and mental health.
And mental health, yes. So our recommendation is to fund implementation and or expansion of youth and adolescent recovery support services throughout Colorado by creating recovery community centers, mental health clubhouses, recovery support service organizations. These services will foster whole person recovery to an underserved population. And they will include development of youth and adolescent recovery support services that are championed by the youth with mentoring and oversight from RCCs, mental health clubhouses, and RSSOs, implementation of recovery support groups, sober activities, supported employment and education, sober safe after school programs. And these services will be implemented not only within the schools, but also throughout the communities. And they will be recovery focused on community building, community support, and introducing the many pathways of recovery, promoting promoting whole person health, including harm reduction services, just to acknowledge that we recognize youth do have access to substances and may continue to use them. And also creation of youth-specific trainings for peers and supervisors. We also want to build and gather data specific to youth recovery support, and also workforce development, peer-specific training, continuing education around supervision of peers.
Awesome. Thank you, Candace. And then our last recommendation, Travis Ayers is going to take this one.
This one's really special to me. The transportation, I live in Sterling, this entire region over here, transportation is a huge ask and need and an obstacle for people in recovery, for everybody in this area. So this one, it does mean a lot to me. And what this is like James said, it is for transportation for recovery support services. We do this with providing funding to address the transportation barriers in rural and frontier areas to have better access to community-based recovery support services in recovery community centers, mental health clubhouses, recovery support service organizations, and so many more. We do this with by compensating staff peers to drive and schedule the transportation needs, the continued education for peer recovery coaches or the staff members that are hired to manage the transportation, and the vehicle upkeep, the mileage, the insurance, salaries for the staff, contracted ride services, and all of that stuff just to keep that service going. And then some of the examples that the transportation could be used for would be the transportation from and to, or to and from recovery support services and the many different pathways to recovery. The transportation to and from other community support groups, the transportation to and from harm reduction, being whether it's the MAT or MAR services, providing the opportunity to give the ability to provide transportation for the benefit of achieving whole health recovery in their communities. And this could be done with getting them to, to all recovery or other community support meetings, peer recovery groups, recovery social events, mental health clubhouses for access to meet a need to the individual's pathway of recovery. This could also be used for the transportation to treatment or medical services. And last but not least, the legal system or judicial system appointments, whether it be a probation officer, parole officer, maybe it's a court appointment, something of that sort. And that's what we've came up with for the transportation needs for recovery support services.
Awesome. Thank you, guys. And I want to say a special thank you to everybody that was part of the recovery community, because we met multiple times outside of Bhpac. And I know it's hard for all of us to do that, but somehow we were able to pull it off. So thank you, all of you. And now I guess we're open for questions and discussion.
There's a question in the chat. Lorraine just put in there to explain what MAT or MAR services are. So MAT is medicated assisted treatment, or MAR is medicated assisted recovery. So, I mean, without spending hours and hours of time, because we could easily get lost in that, it could be anything from Suboxone to a methadone clinic to just having access to naloxone or any of them life-saving drugs that are still needing a prescription, but that is in process to being changed. Or any types, support groups for people who are on medications too. Absolutely, Tanya. Thank you for mentioning that. And when we talk about medicated assisted treatment or recovery, I mean, that could be so much more than also just looking at the prescription medications or the things that go through that. I mean, harm reduction is so much more, as in seatbelts, condoms, cigarette filters, I mean, them are all forms of harm reduction. And I guarantee a lot of our youth is using nicotine or tobacco, is having sex at that age, all them things. So if we start to break that, like break them barriers, take away that stigma and discrimination just by having them conversations with the youth, things like that.
I saw that Bonnie put in there that she really loved the recommendations, that they're really barrier breakers in terms of inclusivity and equality.
Equity.
Oh, sorry, equity. Oh, my dyslexia.
This
Are
is
there any
Margie.
other questions? Thank you.
I just wanted to clarify. This is for everyone, even if not just in recovery from substance use, but these same would apply to our mental health people that are for mental health issues, not just for mental health and or substance use. So you could I mean, these are phenomenal, but I would suggest that these are so needed for people, for all people trying to get appropriate mental health services and supports.
Yes. Yeah, and we talk about that whole health and whole person, the mental health club. Like, yes, it's definitely inclusive of not only the SUI, but also the mental health side for sure, because it has to be, right? Me included, I have both. I have mental health issues and substance abuse issues. So to think that I shouldn't get the same services. So Margie, maybe that before we submit the final, we can definitely look at areas to where we can kind of clarify that we are talking about both.
Again, I really appreciate that, because again, from the mental health world, at least the child and family, we don't use recovery as the term. So it's how to ensure that others are feeling they're part of this when the term recovery, because as I always said, if I have a 5-year-old trying to get that appropriate services and supports, I'm not going to necessarily identify with the recovery community.
Is there a word or some language that you can give to me that might implement that people are in remission or recovery or healing from their mental health? Like, can you help with any of that?
Yeah, for sure. And I think the resilience is more probably the word that is used in child and family world, but we want to make sure that people are understanding that this is not, I think there's a definition of recovery that wouldn't necessarily have everyone feel that they were part of that piece.
When I think part of the an idea with that, Marjorie, might be for the other like treatment and prevention to take this concept of transportation and really implement that as a recommendation throughout the entire continuum, right? So it's not just about recovery, but maybe it's like you said, the children who are getting transportation to their treatment appointments and so on.
Yeah, I just like, there would be multiple ways to do it, but if this is solely focused on the recovery community, then that's important, and then we would need to do a similar language for the broader mental health community.
Right, I agree with that.
Because
one thing, Margie, that I don't know if this might help in some way, but we didn't really address co-occurring disorders. We could possibly add that as a instead of basically the slides as we have them now, sort of separate out recovery and mental health. And as James just mentioned, a lot of people have both of those.
I mean, to be honest, it fits all three. I mean, there's people with that mental health that it's more, that's their focus. Then the co-occurring is certainly important, and then the recovery. So but there are what's unique to each of the categories. And so I guess that was my question, is if this is focused on the recovery community, then this language is appropriate. And then we need to find other ways to ensure that these same things are happening within the broader community, within the mental health world as well.
And we did talk a little bit about that, Margie. We talked, and it wasn't that we didn't want to leave anybody out, but being it was the recovery committee,
no.
I mean, that really tried to be our focus. I 100% agree with like what Tanya had said, where this is an ask that I think prevention, I think treatment, I think everybody should be putting in a similar ask with their language, with their, you know what I mean? So that treatment has the same access to these transportation needs, so that let's say the youth piece comes into play, and so then they would have that, you know what I mean? It's still, I think it's important that we all stay in our lane per se, and then treatment prevention, that we get these asks out there, because you are right, Margie, this is a huge ask, and it is a huge need and barrier that we all face, no matter what position of this, whether it's treatment, prevention, recovery, that we all have. Absolutely. Thank you for bringing this up, Margie. It's very, very important.
I guess I don't mean to be repeating, but I think sometimes when language is specific then the funding goes to that specific group and then not necessarily to the other. And I wouldn't want transportation not to be addressed as for, like I say, for a child that needs to go to, treatment. So I think
that's
that we can be most inclusive to ensure that no group is left out in our quest to do our work.
I think that's the importance of us saying that everybody should include this, because the work of the recovery committee was designed around recovery. So this it is inclusive of everything, but it is recovery focused.
I think
I
they're
agree with
excellent
Travis
points,
and everybody else.
Margie. Excellent points. So let's I don't know if we need to move on that, but let's accept that recommendation, because I think it's excellent. Margie made excellent points. And so for the rest of us, and since we're still working on treatment, that we do adopt the same or very similar language on our recommendations. Great work. Really good work, recovery.
If I could jump in real quick. I don't know if people are aware of this. Aurora has a wellness court, and the wellness court functions where people are identified with some form of mental illness that commit a crime. And instead of incarceration, they require counseling, treatment, and then ongoing recovery. I interviewed Judge Sean Day, who heads that court up, and I've got to circle back to him because they were supposed to have set up another wellness court specifically for veterans. But these are the types of programs that really should be looked at statewide, because through the breaking of a law, a whole bunch of issues are uncovered on the behavioral health side and addressed. So again, I'll put my website link in the chat. Take a look at it. It's under the BH programs that I have in there. But it's just an amazing program, and I just don't think it gets enough exposure and promotion. And people should be aware that this is a very positive approach to behavioral health issues through the criminal justice system.
Thank you,
So
Dennis.
just one more thing real quick. I think it's important to note that with the SUD block grant, what happens is that there's 20% that is federally mandated to go toward prevention. There is not a federal mandate, although there's likely one coming in looking at the president's budget. However, in Colorado, thank you, OBH/BHA, there was a 10% set aside put in several years ago to specifically fund recovery. And so when we think about this from a perspective of a three-legged stool, or all three parts of the continuum, what I hear the recovery community asking for is back to equity, right? Prevention gets 20%, recovery should get 20%. And that's sort of my 2 cents, and why all of this conversation is fabulous. But if we don't increase funding for recovery, which is the basic ask of the 20% set aside, then that's how we're not able to advance this and move it forward.
Couldn't agree more. Thanks for saying that, Tanya.
Well, with no further questions or discussion, I'm not sure what happens next, Ryan or Marcella.
Well, it seems like, are you, from my understanding, comments earlier, are we ready to vote? We open for discussion? Are we ready to vote and accept the recommendations?
Can I just have a little like insight on the vote? So do the recovery committee, the people that are on the recovery committee, do we vote on our own stuff, or is it for the rest of BPAC to vote on?
If you are a member of BPAC, thou shall vote. Yeah, or have the opportunity to vote. Yep. Do not hesitate to vote for your own recommendations, right? Like this is yeah, it's by your members, right? Like, yeah, so we could do it a couple different ways that I mean, first it's the motion and a second and formal votes. I mean, motions are open to anyone to submit, whether you want to do it individually based on each one of the recommendations or as a group. Like that's totally up to the person that puts forth the motion.
Excuse me, I have a question. Is there any benefit to hearing all of the recommendations from each group before we do a vote, in case some of them may overlap, or it's like, well, I voted for the first presentation, but I wish I would have held because I didn't hear the other ones, and that warranted more conversation? Just throwing it out there.
That has not been my experience in the past. However, Ryan, I think you have more years of experience. I don't recall experiencing that in terms of the voting process. Each committee pretty much stood on their own. Some of it was slightly similar and so on, but definitely no harm as a result. It's a good idea, actually.
Yep. I mean, I think that is the piece, and I think that is the power of coming together as the full BPAC, is that there's that opportunity to really have those amazing conversations that just happened over these last 30 minutes, right? About, hey, fantastic recommendation. How can this idea transfer over into other parts of the continuum, which is fantastic. And Lori, I hear you where it's like, hey, how could this inform other recommendations? And then, but I also defer to the group as a whole with how you want to go about this. I mean, previously it was based off of recommendations coming from committees. There wasn't a whole lot of like back and forth related to the recommendations, updating the recommendations, and then it would be a response back based on each one of these recommendations. But I mean, this is a process that y'all are smart, amazing people that do fantastic work for the state. So like, yeah, this is a powerful group. So
I mean, I'll speak up for myself, but hopefully the recovery community that's done this work over the last, I mean, we've presented, I'd like to get some feedback. I would like to see a motion to vote on ours. I would hate to wait until we meet a month from now and you all not remember what we did. So we'd have to present again to where we just discussed this like we were going to present because we were ready. So I would like to see a motion to vote on this.
I agree, and I can definitely see why Tanya pushed for the process today for the recovery committee. Excellent work. So I call for a motion then. Unless there's still further discussion.
I'll motion to accept all three recommendations for the recovery committee into BPAC.
And I can second that. This is Shannon.
Great. Anything else? We'll move for a vote. Do we want to show hands? Do we want to yell out?
Presumably we're saying all those in favor, yes?
Okay, all those in favor, yes, thank you. I can't. Can everybody see how many?
We do have a majority, so we're good.
Thank you. Motion passed. Recommendations accepted.
Thank you, everybody.
Fantastic job, recovery.
Really?
And Bhpac as a whole, this is, yeah, I mean, a good start. I think the bar was set for the other committees as well. So, I mean, I guess with that, Marcella, I'll kick it to you, but I mean, there is still some time today to even talk about potential concepts from other committees, as we even get prepared or think about June, if we're not quite ready for the more formality of presenting, but to get wheels turning on where folks are thinking.
Okay, yeah. More. Anyone? Floor
This
is
is
open.
Margie. This is Margie. I have nothing in comparison to what the other group did, but we have recommendations that we have spent a lot of time talking about and not putting into quite as that language, but is to have a more clear definition of the term prevention. There are so many different places where prevention is happening in the state, and I think that can be confusing as to really, so that was one of our recommendations, and again, we'll flesh this out more completely. And maybe Bonnie can help with this piece, but look at what the shared risk and protective factors are and the work that she's doing in her prevention world, so that we really can identify, and this is part of the work that's being done in her world, is where prevention is happening across the state. So that inventory piece, as well as what is missing, the gaps, so that we can really have a clear understanding of where prevention is happening and what we would recommend should be happening in the state. But I don't think right at this point we have that picture. And then we also talked about that how to integrate prevention into the other work that the subcommittees are doing, which I think definitely goes with the conversation that we just had with recovery, so that we can maybe pull out the concepts and then put them into a broader scope from the prevention world. I will let the other people on our group share their comments, and included in the piece, say, for example, with what is happening and what is needed, training would definitely be a piece of that, i.e. recommending that mental health first aid, youth mental health first aid, that people are aware that those are opportunities for them to learn. So we will kind of fill in the framework before the next meeting, but those were our overarching themes. And Bonnie and Dennis and Lorraine, if you want to add to that, please.
Well,
I would just
from my-
say that, I'm sorry.
No,
Dennis.
go ahead. You go first.
I would just say that it was a pleasure to be in on this committee. It's been a pleasure to be on the other committees I've been on, but I hadn't ever sat in on a prevention committee. And we kind of set the overarching element that Margie explained, but we also, as I'm sure other committees have had, we were talking about how to do it, and we shouldn't be necessarily talking about how to do it, but we can't help ourselves. So at some point, we would like to continue the work that was started in the creating these recommendations. We're going to send them off next month or the month after that. We want to continue further along, and I was very comforted and proud, if I can be proud. It's kind of like being proud of your kids when you didn't do anything. Proud of this committee for the work they've already done for education and raising awareness. So that's all I wanted to say.
Good job. One thing I want to point out is, we are trying to broaden the scope and understanding of prevention, of which mental health is a key element. A statistic that was pointed out to me by Dr. Ross, 40 or 63% of substance abuse has its roots in childhood trauma. We have another real major problem with youth and even adults being radicalized and becoming violent, primarily because they're isolated and they end up in an echo chamber, and then they get vilified by society. So we, have to look at outreach in order to see that. But again, getting back to what Margie was pointing out, we're trying to redefine prevention and expand it. And the thing that I liked about our discussion was we talked about how to prevent and mitigate negative mental health outcomes as prevention. So that's where, Margie mentioned this can be part of every other part of the continuum of behavioral health. And so, prevention through education and training and outreach is going to be the key.
And I think, thinking about integrating the ideas of prevention across the continuum of care, when I heard the recovery group's recommendations, including, enhanced access to services through transportation, I heard things around living wages and just things that address those social determinants of health. And so when I think about a shared risk and protective factor and social determinants of health, they absolutely go hand in hand. So I think that's a great example of how these ideas and concepts can be integrated throughout the whole continuum of care.
So thank you, everybody, because we really are a team effort here. And just to know that in June, we'll work together to wordsmith our recommendations, but Bonnie is not going to be able to be with us because she's at the Risk and Protective Factor conference, and I will not virtually attend during that time, but just to know that we will get that there. But I just want to say our work with Bonnie is invaluable, and unfortunately our meetings overlap with what she's having to do next month, but we will learn a lot from her Risk and Protective Factor conference, I'm sure, as we move forward. So other people, thoughts, comments, questions? We'd love to hear from you.
Your work also is great. Excellent discussions. Definitely due in June. We've got a great sample, great example for our presentation, both prevention and treatment. And so we'll be set, it appears, for June for our presentations and for votes. Ryan, anything else? Thank you for helping out today. You were great as I was going through my little attack. And anything else?
The only pieces is that recovery, will you share or send your slides to Donda so we can have those and start getting those together? Same with the other committees. Once you have stuff, definitely send those through Donda as well so we can get those out to the group as a whole, so we are as prepared as possible for June to pick up this conversation. I see that there in the chat there was a kind of the what's going on, more of the agenda item that I think we should went quick. So even in these last couple minutes, if we want to have a quick conversation about if there's any other events that are potentially happening that you want the group as a whole to be
I'm
aware
about to
of.
wrap up in a meeting. He can leave a message. Thanks.
Ryan, are we also going to have any time at all on legislative updates?
Yeah, I mean, with the last 8 minutes here, I mean, there's 4 days left of the session, so it's just wild times now. But that's another thing that we can try to have for June as well, as just the legislative wrap up where the behavioral health pieces of legislation fell. Our policy and ledge team is currently putting together a kind of a session wrap up that I think would love to get opinions from this group about how beneficial that is and could be. So I think there's definitely some opportunities in that. Even I'm guessing we'll have that prior to the June meeting, so I'll try to get that sent out through Donda as well with the, hey, here's what happened during the session. Yeah, and as we prepare for the interim, which the opioid and other substance use disorder interim committee is also happening this interim as well. So yep, there's some other moving pieces that will, I'm sure, love the involvement of informed folks like yourself as part of that as well. But Tanya, I see your hand.
Yeah, thanks, Ryan. I just want to say that our annual Rally for Recovery will be happening on Saturday, September 16th. This will be our 22nd year of celebrating recovery in downtown Denver. And there's going to be some other ones around, like they're going to do one in Sterling and in other parts where we have other offices and so on. So just wanted to say that out loud so you guys can mark your calendar. That's the big one in downtown Denver, September 16th. Also, I noticed that Travis asked about Senate Bill 109. And I'm going to let y'all do the legislative update, but I did want to say that Senate Bill 109 is going into committee tomorrow. And with my team, I can give you guys the update and talk about what we need to do. For those of you who may not know, that is a bill that is creating drug-induced homicide, which is a horrible thing because the concept is not horrible, but the way it is set up is horrible because there's no differentiation between the guy or girl who's bringing huge amounts of fentanyl or any other drug across the border and bringing it into our country or into Colorado, which we know is devastating for our communities. But there's those folks, and then there are the people who are using drugs currently and they're sharing those drugs, or if I'm addicted and I'm selling a little of my piece, then so I can support my own habit, those people will be lumped into the whole thing, and there will be mandatory sentencing laws. And I think about people who lose their spouse or their friends or whatever, and not only would they lose that person, but they could potentially be charged with drug-induced homicide and do a minimum of 30 years in prison. So 32 years. Thanks, Travis. And so those things are critical. You know, we can't punish our way out of this issue, and we lost the war on drugs. And so if you want more information, look that up on the Colorado Legislature website, Senate Bill 109, and you can see the information and see the committee work. And oh, thanks, Ryan. Okay, I'll be quiet now. I said my piece.
Great seeing you, Tanya. Great seeing you. I'm glad we're all still hanging in here and still doing great work. Thank you. Thank you. Yeah. Thank you. What's next? Ryan, do we make a motion, request for a motion to close?
Yep, I think that's where we can go.
Let's go. May I have a motion to close?
I'll make a motion to close, to adjourn.
I'll second that.
All set. I think we're all ready. Yes? Thank you so much. Again, Ryan, did anybody hear from Bob?
Yeah, he said there's some thunderstorms happening where he's at, so internet
Okay.
connection was
So he's cool.
tough.
Good,
Yeah.
good. All right. Needed to ask. Thank you so much. Have a wonderful month.
Thanks, folks.
Thank you. Bye-bye.